Hello together, my name is Ilja Solomonovs and I'm a founder and CEO of Senmotion. And besides me, we have three other co-team leaders. This is Dimitri, who is bringing his great experience from Leica cameras in developing hardware and software. And we have two professors. Thomas Ertelt is responsible for analytics and biomechanics, and Thomas Gromwald is responsible for motion training and motion science. And yes, both professors are 100% involved in our company. And we are focusing on digital health. And digital health is, besides the social impact, really interesting from the perspective of investment. Just in US, we had in 2017, almost 6 billion investment in digital health startups. And this number is continuously growing. And although there are really interesting exits with over 1 billion evaluation in this segment every year. This segment is really big, and to give you an example, we are focusing on DSM, so-called musculoskeletal diseases. Almost every one of us will have some problem with this. It can be knee pain, it can be hip pain, it can be lower back pain, etc., etc. There are over 150 different illnesses in this segment, and not many people are knowing this is the second largest case of early retirement worldwide, and one of the biggest cost blocks in rehabilitation. So just to give you an example, there are almost over 1 million surgeries in hip and knee tap in USA, and in Germany we have every year over 500,000 surgeries. So it's a cost block of over 34 billion euro every year just in Germany. Those markets is really huge. And to get treatment, to get diagnosis, it is really important to understand how our body is moving. And for get this information, you need to visit motion labors like this. They are really cost intensive, they are really expensive, and all you get is just few steps, few motions. It's barely nothing saying about our motion in the day. So we decided that we need to disrupt this, and our solutions look like this, that we are developing wearables which are as good as medical products, which can get you individual data. Besides this, we have a scientific database. We have different patterns from illnesses and for healthy people. So we can use machine learning to provide real-time diagnostics, personalized therapy, and you don't even need to go to a hospital, because you can use our wearables at home, and the doctor can use a telemedical approach to see what is going on and adjust your therapy if it's necessary. And there are many possible information from our movement, and we were thinking, what is the first product? And we decided that our first product gonna be insoles, which can track pressure distribution. Pressure distribution is if I'm walking, how much and how long pressure do I have here. And this information is really important for many illnesses. For MSD, it's also for neurological illnesses. It's really important for mental health, like depression, diabetes, fall prevention, sports, etc., etc. So there are a lot of use cases for this. And this is why since here, people are trying to bring out such a product on the market. And this is a study from 2017 where you can see the comparison of gold standard, which is using right now in labors, with the two medical products which are on the market since years. So this is our two leading products. So if you compare the data they get, you see that the red line is the gold standard, and you get big loss from the sensors there as a medical product right now on the market. So it's almost impossible to use these gadgets at home. It is not possible to use this gadget as well in labor. So you have a big information loss. So we started with the development of our sensors, and what you can see is groundbreaking, because this is running and this is compared with the gold standard. And you see our sensors as good as a labor. So we put the whole labor I showed before in the shoe, and you can wear it the whole time. You get the information digital on the cloud, and the doctor can see it as well. This is why we have a really good chance to be a leading company in this wearable segment, which is focusing on medicine, because many companies are trying to get there, but the case is, the base is sensors. The information you get is really important, and then you can do all this analytics, prediction, et cetera, et cetera. So let me tell you about a few informations about us. We started with the idea in 2016 and developed our first prototype, which was based on the standard sensors available on the market, but we realized it doesn't work. And so we started to develop our own sensors, which we get in 2017. In the same year, we get our first funding and founded Senmotion and used the last time to develop our product and finalize it. And since few weeks, we are part of a motion capture group, and my colleague, Hartmut Voss, will pitch next and will introduce what we are going to do together next. Thank you.